Before we get into this vaccine tech transfer hub, I wonder if you can briefly explain to us what messenger RNA is and why it's proprietary.
Sure. So what mRNA technology essentially is a series of instructions that we inject into your body, and then your body produces a protein that these instructions code for. And in the case of the mRNA COVID vaccines, the protein we are injecting the instructions for are the COVID spike protein, which is on the surface of the coronavirus. And then when your body actually encounters the virus in real life, it is then able to mount an immune response and protect you from infection, or at the very least from the most grave consequences of infection, meaning you don't have to go to hospital, you're not going to end up in ICU, and most importantly, you're not going to die.
Okay, so the drug makers have a computer code, essentially, in a manner of speaking, for creating that response. And of course, they've developed it, and they hold on to that. This hub is the first of its kind, but what I find really interesting, Manuel, is the sequencing of all this, right? Because the WHO announces this hub with partners like African universities and local drug makers, and this all takes place before the companies with that code, Pfizer, Moderna, have agreed to share their vaccine intellectual property. So this looks and sounds like a pressure campaign. Does this kind of pressure work in these kinds of instances?
I'm not sure I would call it a pressure campaign. I think what it is just a very logical sequencing of events. It's very easy to just say the slogan that Moderna and Pfizer and BioNTech should share the vaccine technology with the world, but how you pragmatically do that is something entirely different. And that is what the WHO and South Africa have gone and done. They've provided now a hub that both these mRNA developers can transfer their technology to, and this hub would then take care of the training of staff on the continent to produce this vaccine in not just one location, but several locations, which takes some of the work away from the developers of having to do it one manufacturer at a time, and allows the vaccine to be manufactured in a more geographically distributed way and in a more decentralized way, meaning that a few countries that have been hoarding most of the vaccines have less capacity or less ability to do so.
So COVAX clearly is no longer a reliable option since they've been running out of shots. Do we know if Africa is getting shots produced by China and Russia, who have not made any secrets about their willingness to engage in vaccine nationalism?
So I wouldn't say that China and Russia are the only countries that have engaged in vaccine nationalism. One could classify the vaccine hoarding by all high-income countries as a form of vaccine nationalism.
Fair.
But certainly these countries have been receiving vaccines from Chinese manufacturers and also some from Russian manufacturers. And actually, some have been receiving more from them than they have been receiving from COVAX.
Why didn't the WHO pursue this tech transfer hub sooner? I just wonder if they've been running multiple tracks for the developing world, whether it's COVAX, whether it's getting shots from different countries, including Russia, China, and then also establishing some kind of hub.
So something was actually tried last year, something called the COVID Technology Access Pool was established by the World Health Organization. It was meant to address all COVID technologies. It primarily focused on the intellectual property aspect of sharing COVID technologies and less on the technology transfer aspect. Unfortunately, very few private companies actually submitted their technology to this access pool. And 1 year on, very little of it, if any, has reached developing countries. Now, for vaccines, technology transfer is really an important step. And that's where we need this pragmatic hub that can really transfer this technology to various different manufacturers, and that's what the WHO has gone and done. I would consider this more a follow-up to the COVID Technology Access Pool that they already have created.
Oh, well, thank you so much for explaining that. Do you think we're going to get any resistance from the likes of Pfizer, BioNTech, and Moderna to sharing the code, that their intellectual property?
Perhaps. I hope not. I hope that, as they keep saying in media, they are committed to the global response to the COVID-19 pandemic. These manufacturers certainly have made enough money already. They're due to make many billions this year. So financially, they wouldn't lose out on very much if they shared this technology, and they could greatly help the coronavirus response. And also actually going beyond COVID-19, because this technology platform can be adapted to viral threats that exist on the African continent continent that keep reappearing, and we have seen very little action from high-income country developers to address these viral threats. And perhaps manufacturers and developers on the continent can do a better job moving forward.
That's a really important point. I hadn't thought of that. The potential for further work on addressing other kinds of diseases. I also want to ask you about the JNJ vaccine, because it's become kind of a non-factor in the U.S. because of the reports of blood clots, however rare they've been, which is a shame because it's a one-shot solution that doesn't require very specific cold storage. Do you think Africa and the developing world should write off J&J's vaccine as well?
I think as long as people need vaccines and we don't have enough vaccines, we shouldn't be writing off any effective vaccines. It's a shame indeed that the risk-benefit communication has been suboptimal around specifically the adenoviral vaccines, so the J&J vaccines and AstraZeneca. Having said that, I think everyone is free and should be free to choose whether or not they want to accept a particular vaccine. We seem to be okay and accept that in high-income countries, which means we should be granting the same kind of autonomy, of course, to developing countries and patients in developing countries. And we can do our best to communicate very clearly the risk-benefit, but if in the end the choice is not to take the vaccine, as has been the case in high-income countries, we need to respect that and we need to do everything we can despite that to make sure that these people get their vaccines.